Hello, I am Dr. Kumudini, Consultant Obstetrician and Gynecologist, Bangalore. Here to the Kamini Rao Hospitals, I have come for the clinical attachment for 15 days. Here we get to see patients and get to interact with the patients, and we can take the history and we can see the protocols, what they've been used, and it's very privileged to work with Dr. Kamini Rao, Dr. Kotta and Dr. Shanthala. Here we observe a lot of complicated and critical cases where they have previously failed IVF cycles, previously failed donor cycles. Laparoscopic surgeries like ECMs we observe, and in uterine anomaly cases, hysteroscopy cases, ovum pickup cases, and embryo transfers. So we get to know a lot of IVF protocols to do, and in different cases what protocol to be used, what protocol not to be used, what are the precautions to be taken, what are the contraindications, we get to know. Before having this clinical attachment, we did simulation course here which helped us to assist ovum pickup cases, and theoretically also it is very helpful to know embryo transfer cases. So we get to know embryo transfer, what type of catheters we use, what is the volume that we use, procedure that we do. The simulation program is one thing which is very useful to correlate the same thing in the clinical practice. It has been a wonderful experience for this 15 days. Thank you Dr. Kamini ma'am and Dr. Anu ma'am, and especially for Dr. Shanthala ma'am to have this wonderful training program and teaching program to most practitioners. It is very helpful to practice the daily cases, and then for our knowledge it is very helpful. Thank you.